I'm wearing it today. That did not need to be on there. Good afternoon. To begin today's briefing, we have a pretty long schedule today. We have Beth Crider, Superintendent of the Peoria Regional Office of Education, as well as Carl Cannon of the Elite Youth Program, and Emily Cahill, the Executive Director of the Park District. To begin with, I'll start with our daily briefing, the to-date counts for our Tri-County region. Peoria County has 42 confirmed cases. Tazewell County has 24 confirmed cases, and Woodford County has 11 confirmed cases. That gives our total for the Tri-County region at 77. Our death counts remain at 5 for the Tri-County region. Today marks 11 days of consistent increases in the number of cases that we have in our region. I would like to note there's been some questions about the Illinois Department of Public Health website and the counts that are listed there. As new labs are onboarding into providing testing capacity throughout our state, many of them do not have electronic laboratory records or ELRs. And because of that, they don't necessarily automatically input into the state system that is used for data purposes for the local health departments as well as that state website. In addition, some of that data is incomplete. It does not have addresses, and as such, if it doesn't have an address, it's assigned to the county where that testing facility is located. And so with that, throughout the day, you might see the numbers on the state website fluctuate based on information from that lab in terms of the residence location and home address and being transferred to that county for that health department to follow up on. So with that, maintaining that the afternoon briefing will be the best opportunity to get to-date and accurate counts for our Tri-County region. In addition, the GIS dashboard that we discussed on Friday that went live, it is updated in the mornings, and throughout the day we do get additional cases. And so again, the afternoon briefing will touch on our most accurate count, and note that the next day the dashboard or the GIS dashboard will be also updated. In terms of hospital data, reporting from OSF St. Francis Medical Center, UniPoint Health, Proctor, Methodist, and Pekin, there are currently 21 ICU beds in use, of which 13 are for persons under investigation and 8 are for confirmed cases of COVID. 20 non-ICU beds are in use. We began reporting this data on April 3rd, and since April 5th, we've maintained in our region anywhere between 40 to 50 beds total in use. Very consistent, and actually a good sign in terms of how the stay-at-home order has been positively impacting the spread of this virus in our community. I would like to also discuss that moving forward, the local health departments as well as the state will be reporting out any long-term care facilities on the state website that are currently under investigation for outbreaks. For Peoria, currently listed is Bickford House. Tomorrow we will have 2 additional long-term care facilities added to that list, and that would be Generations of Peoria and Sharon Willows, all of which have been working in conjunction with the health department for weeks now, monitoring their staff as well as their residents and being positive and just great advocates for their residents and their staffs to control this virus in their situations. I would like to also note that the Illinois Department of Public Health website that lists the long-term care facilities terms all tests or all cases as confirmed. However, that also includes those that are presumed positive as well. And that's based on the state's outbreak definitions. So again, a little bit of housekeeping just to clarify some of that information. And then the last thing I wanted to talk about is tomorrow we're very excited that Heartland Health Services will be beginning their clinics for testing here in Peoria. Tomorrow will be the Wisconsin site or the East Bluff site. This site, which begins, will be open from 9 till 4, and from tomorrow will be operational Mondays through Fridays as well as Saturdays from 9 to 12. Beginning on Saturday, April 25th, the health department will be open as a site for testing in conjunction with Heartland Health Services. And again, we will be only doing Saturday and Sundays only for testing here on site from 9 to 2. And then on April 27th, in partnership with the Peoria Park District, Gwen Park will be open from 9 to 4 on the weekdays as well. One of the things I do want to focus on with the Heartland opening up as a test site is making sure individuals understand that there are prioritizations and risk groups that they are targeting, all of which include individuals that need to have symptoms. Again, this test is really the most effective when individuals have symptoms because they have enough of a viral load for those tests to be accurate. And those groups include individuals that live in temporary shelter, those individuals with a known exposure, others that have high risk, such as older of age range or have chronic health conditions, and then our essential service providers that range not only from our healthcare workers, but to those providing that maintenance of having an essential community. So that includes grocery store clerks, our licensed daycares, as well as other faculty workers. So with that, I'd like to introduce our Peoria County Superintendent, Beth Crider.
Thank you, Monica. Good afternoon. Well, we knew it was coming, but the closing of school and the school buildings for the remainder of the year was very, very hard. We keep using the word unprecedented, so I prepared remarks today because there's just so much to this. We had a Zoom call this morning with all of the superintendents in Peoria County, and here are some of the things that were on the agenda. Graduation, what does that look like? Prom, end of the year grades. How do you pass students to the next grade? How do you get everyone back to clean out their lockers, their desks from classrooms that basically were just left intact and students walked away the next day? How do you get the teachers back in to get their things for the summer? What about summer school? Are we going to continue to distribute meals for the summer? How do we honor our seniors who are going through something fairly traumatic? What about spring sports? How do we get the things back that we've sent home? Textbooks, devices, Wi-Fi hotspots. And what do we do with those things when we get them? How do we clean them and make sure that they're safe? There are so many things to figure out. Each district has the local control to be able to set their own policies around these things. But one unifying factor that we all have in Peoria County is we do not want to cause any harm to any student or any family during this time. This experience has been jolting at best, but more likely traumatic. We need to spend a great deal of time for preparing for what re-entry will look like. So we need to close up this school year and also start preparing for re-entry. I'm so incredibly awed and pleased with how well the superintendents within Peoria County are working together, trying to collaborate, share information, support one another. I've got this document, they're sharing everything. So let me conclude with this. My word for this time is grace. We need grace for these really hard transitions that are being made and the lack of time we had to prepare and plan for them. We need grace for the mistakes that we're inevitably making along the way, and I'm sure all of you have been on a Zoom call or a conference call and know those mistakes happen. We accidentally hang up on one another, so we need that grace. And grace for what this gap is going to cause for students that are going through this time and some of their learning. And with that, that's a lot. What questions do you have?
When we talk about this gap, like you said, it's been an incredibly traumatic experience for many children, many families, but there is the fact that a lot of kids haven't been in school since March, essentially, and we're talking about them not coming back potentially till August at the earliest. How do you even begin to address that gap, the fact that there's probably a lot of lost retention of what was already learned before that? How do you make up for that time, so to speak?
So the question is, how are we going to address the gap? We basically missed the fourth quarter. We literally ended right there at the end of the third quarter of learning. So here are some of the things that were discussed today. One of them is that we're using this time to do enrichment, and so we may look at a 7 out of 8 years or semesters worth of a GPA, looking at having this as a time of pass. We may look at a time of having incomplete, but then how do you grade those assignments when they come back? So that is a challenge we're going to have to work through. utilizing summer school and transition time at the beginning of the school year to make sure that students are prepared. But the thing is, it's for everyone. So everyone is going through this and everyone will be starting in the same place. But what I don't want to happen is this. I just cannot stomach grading for equity. If we grade for equity, that means that we are looking at students with no devices. I know of meal deliveries that are showing up at homes with no pencils, no crayons, no paper, much less a device. And so a supportive parental environment or home environment where a parent hasn't been laid off or there isn't stress around food and paying bills. So we cannot harm our students and we cannot grade for equity. So we're going to have grace for what this last quarter of school will look like.
So where do you, is there even an idea of where we start with those students then when they do go into summer school, whether it's online or in class, at least for a portion of it? How do you even begin to get them back into the educational process? Has that been fleshed out yet?
There was a lot of conversation around what does an individualized education plan look like. For larger districts, that's going to be a challenge. We're going to have a lot of conversations around where to start, and it looks different for kindergarten through those younger grades than it does for high school, because if you missed the last quarter of algebra and you need that. We talked a lot today about credit recovery over the summer, potential online courses and utilizing those platforms, but then you have to layer on top of all of that budget concerns and can we afford to provide summer school after what's going on in the economy right now. So lots of challenges we're going to have to process. And each district will have to have their policies around how they're going to handle this last quarter of grading and missing work.
Have you all at all thought about continuing e-learning or packets on through the next school year, or is it most definitely going to open back up for kids later on this year?
So the question is, are we going to continue e-learning into the next year? I can say this, we have used this time to learn, retool, and figure out what our gaps are as the educators, and we will be much more prepared next year should we have to shelter in place again or if we have a snow day. So there will be opportunities for us to use these new skills that we've all learned through this time, for sure.
In terms of teachers, are all evaluations put on hold, or is that more of a state decision? Kind of how does that work?
Teacher evaluations were wrapping up as we left, almost right to the date. Some school districts had a little bit of a line there that they needed to work through, and so they worked that out with their teachers' unions.
Can we talk a little bit about what some of the districts here in Peoria County are considering for graduation options? I know some are considering like virtual graduations, and they just have the light up thing on Friday where they lit up all the football fields across the state. What does graduation look like? How is that going to be recognized in some form? Graduation
is very personal. I have a senior in my own home that just received her honor cords this week. That's personal, and that hurts. And there's a lot of grief around that. So much work that goes into graduation. So what I heard on the phone, on the Zoom call today, a plan A, a plan B, and a plan C that revolves around not too much discussion right now about virtual graduation, more about a postponement. Maybe doing something in June and July. One district was considering prom on Friday night, a graduation on Saturday with the graduation party on Saturday night sometime at the end of July. There's even a district that has a plan C around Thanksgiving time when everyone comes home on that Wednesday. For the school that we run, Peoria Regional, we're talking about having students be able to walk in our ceremony in December so that if you want that experience that you can have it.
When it comes to sending kids off to college, are there any concerns with certain classes that have to be done, or making sure that students have all the credits in order to move on to college?
So the state of Illinois has a lot of good guidance around things that are dual credit. That is with your community college and with AP testing and how that can get done. So we've got good guidance around that. In terms of GPA, we're getting a lot of flexibility from the colleges and universities who themselves have had to make a major pivot. So we're getting a lot of good flexibility there, and I'm hearing this conversation. March 16th was the last date. You can take your GPA and your final as a senior for that day and be done. Or if you need to improve your grade, because we're not causing harm, but the state of Illinois said you can improve your grade, you can finish out this semester and you can improve your grade. And that's what will follow you and travel on. I am hearing also that there probably will not be many finals in Peoria County this year.
Thank you, Beth.
Thank you, Superintendent Crider. Now we actually have Carl Cannon, who is the Elite Youth Program Supervisor, to talk about the impact of COVID-19 has with youth.
Thank you, Monica. Put my eyes on, folks. Okay. I was asked to come to the press conference today to speak to our kids about staying safe in a coronavirus pandemic. As I was preparing my remarks, it occurred to me that kids probably won't be tuning in. And even if they did, you have to remember that they're kids, and kids don't always listen. So I'm going to shift the conversation to where I believe I can get the most help. Their parents, their extended family, and their neighbors. For some reason, kids think they can't get this virus. Big news. They can get it, and they can die from it. At the very least, they can carry it home to their parents and grandparents who are very vulnerable to this. And people who die from this virus, sometimes they die alone. You can't even be with your child if they die from this virus, but you can be there now. As parents and neighbors, you are the first responders. When it comes to your kids, you have to start responding now. We don't exactly know how it's transmitted, but we do know that social distancing works. And in this community, there is not much social distancing among our youth. As I sat in the parking lot, I watched two groups of kids go up Sheridan Road past this facility, grouped. Every time our elite compliance officers visit a home, we're now doing what we call a sight hug. What's a sight hug? You knock on the door, you ring the doorbell, you step back 6 feet. You're fully prepared. You got face protection, you have gloves, you got a bottle of hand sanitizer, and you're saying to that child, are you all right? You're saying to that parent, do you need anything? Our kids might need a sight hug. So if that's the case, then contact your local school. We'll come. There are 3 things you can do, parent, to protect your kids, your family, and our community. Shelter in place at all times. Teach them the importance of social distancing if they have to go outside. And love them enough to tell them what they need to hear, not what they want to hear, because if you tell them what they need to hear, you're going to say, stay at home. Wear a mask if you go out. Stay 6 feet away from everybody. Wash your hands frequently, 21 seconds minimum. Yes, that might make them mad, but that's okay. Your kids will get over being mad, but they might not get over the coronavirus. My grandson and his cousin got mad. Yesterday, I was cutting the grass. They were out front with a basketball. I said, knock it off, get in. They're mad. But I love them enough to tell them no. No one more time at the right time can save them from a consequence.
Thank you, Carl. Our next speaker is Emily Cahill, Executive Director for the Peoria Park District.
Thank you, Monica. This is not the first time that I have had to follow Carl to the microphone, and every time I'm always like, darn it, it's me again. That is outstanding, and I just want to take a minute to just reiterate certainly what Carl said. It is really important that we are all making good choices. And certainly that's what he talks about regardless of whether we are in a global pandemic or not, right? But as far as Parks and Recreation, the week of weather that we have coming is a week that I couldn't have bought if we didn't have all these constraints around us, right? April is usually very wet. There's a lot of trouble. This one is a beautiful week coming for us. And it is really important that we resist that desire to get out in large groups and to do the things that we've always done. It is really, really important that we continue to use our parks and trails safely. We have had a lot of great use over the last several weeks, and we've talked about that here in this room, that people are generally doing a really good job and being responsible. We need them to continue to do that. We need all of you to continue to do that. We know that when people are able to get outside and spend time in nature, that it's good not only for them physically, but also emotionally with all the stress that we are dealing with in these uncertain times. And so I just wanted to certainly reiterate everything that Carl said, but to make clear that our parks and trails are there. We are pleased to offer them to the community. We want to be a part of the larger solution, and that means just that. That means that the people who come into our parks and trails in order to spend time outside need to do that smartly. They need to honor social distancing. They need to wash hands before and after they visit our parks. They need to think about using our parks in the way that they are generally intended, which means walking, hiking. It doesn't mean pick up football game. We took our rims off for basketball. We talked about that the last time. It doesn't mean pick up basketball games. It really means doing those things that you can do in very small groups. At the end of last week, we were forced to close our tennis courts. I know there's some questions around that. Again, that was done in the name of public health because we couldn't control those crowds. We got guidance from the U.S. Tennis Association that there was a lot of concern about the transmission of germs using the tennis ball that everybody's going to touch. And so we made that decision based upon public health tenets. We want to be a part of the solution so that we can move us forward and be ready to play and use our sports fields and our parks and our trails the way that we are intended to use them. And we look forward to the day when that happens. But until then, we want to be a part of the solution and make sure that people are being smart and safe when they come into our parks and trails.
So along with Carl Cannon, Emily Cahill, and myself, there is also Scott Sorrell, and we're open to any questions from the group.
Monica, the governor today said places with lower cases and good hospital capacity should get a look at possibly opening sooner than, looking at Chicago, New York, cities of that size. Do you think Peoria would be included in that?
So the question is, based on the governor's comments regarding the number of cases, as well as the capacity of our hospital systems, is there a possibility that our region might be one of those that opens slightly sooner than others? In fact, the Illinois Association for Public Health Administrators, which is a group of public health administrators that covers 102 counties within Illinois, we've been having a lot of dialogue about this. And one of our biggest concerns moving forward is testing and understanding our true capacity issues. I know I've spoken to this group a lot as well, but until we have a fully understanding what that community transmission rate is, it's really difficult for us to necessarily know, are we truly seeing what's reflected in our population in terms of our case counts and in terms of our hospitalizations. And so I think as a region, as well as other public health administrators, like I said, we've had 11 days where we have consistent increases in our cases. On certain days of the week, we've seen jumps of 5 or 4, or more cases. And so while I would love us to be in that position, and I do feel our healthcare capacity is strong, my concern still is once you start relaxing those regulations, one, it's going to be difficult to bring them back into play. And so to do so, making sure we have that information to start that process. And testing is going to be our best data point for that.
Speaking of testing, obviously, one of the first ones in Peoria opening tomorrow. When you look at the McLean County site, they have about 86 cases, I believe, confirmed, and 40 of those are all from the McLean County testing site. Do you believe we'll see that similar results here in Peoria?
So the question is, with increased testing, similar to McLean, will we start seeing increased cases? And I think definitely. I think whenever you start testing your population, you're going to be able to get those individuals that are symptomatic, that might not necessarily think that they're severe enough that warrant the traditional testing that we had prior, which was in the hospital base, but more community based. They're more willing and being identified sooner. And so while it might be catching those milder cases, overall we're getting a better understanding. And again, that data point is going to help us lead us to relaxing some of those restrictions that we spoke about.
I know you spoke about numbers earlier. I don't know if this is what you were referring to. Over the weekend for Tazewell County, it said that the amount of cases were in the 20s, and then they're in the 20s now, and they shot up to over 40 cases and went back down. Was that what you were referring to earlier?
Yeah, so the question about Tazewell having at one point been in the 24 range all the way up to 42 and then back down to 24, and that's exactly what we were talking about in terms of when more and more testing facilities, where actually they're running the tests themselves, are getting online. Not all of them are inputting all the data and the timely fashion into what we utilize at local health departments. And so with that, depending on where that testing site is located, in this case it's Pekin, that local county actually collects all of them before they transfer it to other counties. And so likewise, the county, Tazewell County got over 20 additional cases that belonged all the way to the Chicago suburbs and some here locally.
So with the nursing homes that you mentioned, one being the Bigford, which is already online, which you said would be going online as well. Are these residents that have tested positive, is it staff and residents?
So the question is, the 3 long-term care facilities that have outbreak definitions by the Illinois Department of Public Health Standards for Peoria, which is Bickford, Generations of Peoria, and then Sharon Willows, all of which have both residents and staff that have tested. And I think this, again, reiterates the point that while our long-term care facilities have put in some of the most stringent restrictions earlier than many other entities, the fact that this virus can be mild and can be transferred by asymptomatic individuals just highlights the importance of kind of that behavior that everyone is positive, everyone has the virus, and why those non-pharmaceutical interventions are important.
So how many cases do they have?
Sorry.
How many cases do they have to be considered an outbreak as you labeled it?
So the question is, how many cases does any congregate living setting, which includes our nursing homes, have to be considered an outbreak? And the Illinois Department of Public Health definition is you have 1 confirmed case plus a second case that has symptoms within 14 days, so during that incubation period, or presumed or suspect cases within a 14-day period of each other. And so that's why if you look on the website, I believe Bickford lists that they have 13 confirmed cases, but those all 13 are not test confirmed. The way it's listed on the IDPH website includes presumed cases as well.
So if a resident in one of these nursing homes is tested positive, they go into the hospital, they're discharged, are they being sent back to the nursing home or are they being sent to the 4 points? I mean, where do you go after that?
So the question is, an individual in a nursing home, once they are discharged from the hospital, where do they go next? And one of the conversations we had early as part of the planning phase for our long-term care facilities was recognizing the fact of their ability to bring back a resident into their facility. And that's been really important for them. They actually have a history of this, whether it's influenza or other illnesses. When individuals are hospitalized, they do bring them back, and they have airborne and droplet precautions. So our long-term care facilities all had the ability to bring residents back in place and keep them properly isolated for the recovery period.
Monica, with talks of reopening, I know that might not be tomorrow like people want, but from the health department's perspective, what would be the businesses that open first, and how would that be monitored?
So the question is, and we start having these early discussions about opening up, what businesses would be maybe the first ones that move forward. I don't necessarily know if we can categorize them by businesses, but maybe understanding that you're going to have capacity issues across the board. I think we had 3 great speakers really talk about it today. You had a school district that talked about the fact that remote learning is now the new norm until the end of the school year. But you also have a park district and a youth program that has actually supported students and families in the summertime as part of childcare. And so you have to have a conversation. It's not necessarily by business types, but looking at also capacity issues. So maybe we bring people on or different entities on, but maybe you're not housing 200 people. Maybe a restaurant's not open to the full, and you are asking your fire marshals to say, hey, we're going to go to a quarter of your census. Those are all conversations that talk about when we kind of think about opening up capacity.
I know the World Health Organization was recommending that local with alcohol. I wanted to hear your input on that, even though that's not a decision that would be made by you. Do you think that that would help? And also, why is alcohol synonymous to possibly contracting or spreading COVID-19 even more?
So the question is about alcohol and the recent recommendations from the World Health Organization. And the World Health Organization is looking at data from throughout the globe and understanding what are the different risk factors associated with transmission. And some of the data they got from different countries aligned it with alcohol consumption and whether an individual's immune system or the ability to fight off a virus changes, or the fact that alcohol oftentimes is utilized in a group setting. So is that part of what the transmission happens? I think the data is a little bit too soon to tell, but I think overall a lot of the discussions around alcohol is just one of the many mechanisms to look at how do you restrict group and large gatherings.
Back to the nursing homes. So this is on the IDPH website,
Yes, the nursing home data is on the IDPH website.
and this is for outbreaks, not just cases. Like, a nursing home could have a single case, but they wouldn't be listed.
Correct. The information is for their outbreak investigations.
Okay, so do we know how many nursing homes in Peoria have cases, period?
Yes, we do know how many, and it's 3.
Just those 3?
It is.
Okay. Good.
It's my understanding that Peoria County Health Department is going to allow some mobile food providers like food trucks and food carts come back online. Can you talk a little bit about that?
I think the question is about Peoria and other entities looking at mobile food units coming back online. And I think this is a phased approach, understanding that it's one of our seasonal food establishments that don't necessarily operate all year round because we're in Illinois. But how do we bring them in back online to have an option to serve food, as well as making sure that they are doing all the protective measures they need to. And so our Director of Environmental Health has been in discussions with all of our food establishments, not only to help them with their self-assessments, because they are actually still assessing for food safety during this time period, but also for those seasonal vendors such as food trucks, and see how they can also be a part of the solution as well.
So what would that look like potentially? Because I mean, there would be some restrictions like social distancing if you're outside standing in line, for instance.
So what kind of requirements might be in place for a type of food truck to open? And we're actually getting a lot of guidance out from the West. So California has, both from a farmer's market standpoint as well as from food trucks, has been kind of giving some guidance. And so looking how that would be able to be implemented here locally. And so that could be that social distancing, creating that spacing, also maybe looking at how do you create lines, as well as kind of organizing your space in general, all of which are options. And then, of course, making sure you have hygiene, hand washing availability, as well as face masks and other protective to protect the essential workers, those food establishment individuals, and the public.
With testing trucks starting tomorrow, how are supplies? Have you been having any difficulty getting supplies?
So the question is about, with testing starting tomorrow, are there any concerns about supplies? Right now, our biggest need for supplies is actually gowns. We do have enough to operate, but the question is how do we are able to operate further? We have the PPE in terms of gloves, as well as face masks, and the sites are actually having enough supply for to do those type of testing. But I think the more we need is always going to always be requesting, and gowns are actually one of the ones that we're hoping to get more of. We don't need it next week, but again, as we start planning further along, and I think that's the important thing to note. This is still, the order ends in April, but we want to keep planning as long as we can for this.
And how about all the swabs and the different things that they need? Is the state come through with that?
So the question is about swabs and testing material, and I think one of the great examples of how universities have stepped up in this process is that testing reagent and swabs are actually now being processed through our state laboratories for the universities. And so I believe Heartland Health Services is slated to have 100 tests per day. They have the ability to request more or less depending on volume, but they are starting at 100 tests per day.
Per site, wasn't it?
Per site.
It was per site.
They had said 150, so has that changed?
I believe it, just clarification, it is 100 per site per day.
I have a question for you.
Okay.
viewer question for you. People curious about summer camps through the Peoria Park District. They're giving specifically Ancient Oaks where, there is kind of room for people to spread out. And this is specifically concerns for, essential workers that kind of need places for their kids to go. Any talks about that?
So the question is, what will happen with summer camps? At this point, that's a really good question, and it's one that we are spending a lot of time on. Unfortunately, some of that direction we're waiting on from other sources, right? So the governor is who is really mandating how schools are handled in those gatherings of children. I imagine there will be guidance for us as well. We certainly take that responsibility of being able to serve adults who have kids who are generally older than what is served by a traditional daycare. We know we play that role for a lot of families as far as summer camp. So we are working on a structure now that would allow us to keep numbers in smaller groups down so that we could manage social distancing. We could make sure that kids are safe. We're trying to put all the protocols in place that we can so that when we get the direction that we will be able to move forward, that we will be ready. What that may mean in some locations is that we would serve fewer kids in a location because of those spaces where we could separate out. The parent who asked about Ancient Oaks is right, that obviously in that many acres of land we could spread kids out pretty effectively. We would just want to make sure that we are doing that smartly. We would still have to be able to move kids to and from if we were to have any sort of field trip or if there was inclement weather. But we are doing everything we can right now to be prepared for that. And our intent is, as long as it is allowable, contingent on where we are in that process of reopening, that we want to be a part of that summer solution for families. And we want to be a part of that engagement opportunity for kids that Carl Cannon talked about. We know kids are missing each other. We know they miss that social interaction as much as we do, and we want to be a part of that process to allow them to re-engage with their friends and with the community.
I know the Park District is doing a lot online right now to help
Yes.
keep kids engaged and keep them active. Is anything like that going to go on through the summer, such as summer activities that you guys normally offer?
So the question is, we're doing a lot on social media right now to engage with kids and families. Will that continue with through the summer? And my answer is probably yes. We know just by the very nature of some of the kinds of programs that we offer that some things are going to be able to come online faster than others. Some things that we do have more problems with social distancing, right? More challenges. And so it will be that everything won't just like flip a switch and come back on at the same time. And so yes, we certainly intend to continue to engage with families. I would note that Wednesday marks the beginning of the 50th anniversary of Earth Day. So we are going to celebrate Earth Week in the Park District on social media from April 22nd through the 29th. You'll be able to engage in multiple activities each day that target ways that we can take care of our planet, that we can celebrate Earth Day at home, and that we can be a part of the larger solution.
Are there any other questions?
How many long-term care facilities are there in the Tri-County area?
I can't say for the Tri-County area. I know that we've been working with over 45 entities here in Peoria County, and that includes long-term care facilities, skilled nursing, and even home health services, because we recognize the importance of what they do as well.
And so those would all be included in those IDPH listings?
Home health services, not necessarily. Those are those independent agencies that may send nurses to individuals' homes to help assist. But yeah, we have about 45 that we've been working with consistently for the past almost 2 months now.
So when you say 3 for the whole Tri-County area,
No, that's 3 for Peoria.
3 nursing homes in Peoria,
Yes.
Bickford's in Peoria, Sharon Willows is in Peoria, but Generations is in East Peoria.
There's 2 Generations site, and actually Tazewell County has been dealing with an outbreak at the Generations of Riverview, which is the East Peoria site. There's also a Generations of Peoria.
Oh, okay.
Yeah.
So Generations, both the Generations have cases?
Mhm.
Okay.
Great. Well, thank you guys, and we will see you guys tomorrow.